Hi, my name is Michaela Sokola. This is my handler Chrissy and my horse Baloo. Today we're going to go over the different vital signs and what is normal and what is abnormal. So the first thing we're going to start off with is the mucous membrane. For the mucous membrane, you can check under their eyelid or in their gums. You want it to be always pink and moist. Abnormal signs could be if they're yellow, that's a sign of jaundice and liver failure. If they're white, it could be anemic or shock. If it's brick red or blue, it could be lack of oxygen. And if it's red, fiery red, it could be infection or fever. You also do not want them to be dry because that means they are dehydrated. So when you check them, you're going to do the capillary refill. So again, you're going to lift up his upper lip, in which his are really pink and moist. Oh, bud. And then you're going to push and hold, and it should come back to normal in 1 to 2 seconds, which his is. That means he is nice and healthy. He is a middle-aged horse, so he is very healthy right now, and you always want to make sure their ears are up and alert. So the next thing we're going to talk about is his pulse. So for a normal pulse, it should be 32 to 44 beats per minute. So for a horse, you will check, you normally would do it for 10 or 15 seconds. For a horse that is in a lot of pain, normally you do it for 10 seconds. For a horse that is standing still, you could do it for 15, all is your personal preference. I personally am going to do 10 seconds because it's quicker, and that way you have less of a chance of not missing anything. So again, you're going to find on the external maxillary artery right under his jaw, and I'm going to have my handler time once I find his pulse. Sometimes it's harder to find. Okay, go. So I got 6. So 6 times 6 is 36, so that's in the perfectly normal range. Your horse is more active and has just had a workout or had been ridden. Again, it'd be higher. If it's lower, they could just be really calm or sleepy. You want to make sure you have their normal vital signs before you do anything and you first get to know them. So you're also going to want to look for, along with the pulse, a digital pulse or a radial pulse. The digital pulse you can find right below the fetlock. And all horses do have a digital pulse and a radial pulse, but it's very faint. You should not be able to feel it unless something is wrong with the foot. So for him, I'm going to sit here and I'm going to feel it. See if I can feel anything, which I can't, which is a good thing. Also for the radial pulse, you can then check behind the knee. The next thing we're going to talk about is the skin pliability. So you're going to check if they're dehydrated or not. So for this, you're going to pull up, and it should go back to normal within 1 to 2 seconds, which his is. An older horse will take longer to go for his skin to go back down, and that is just because of age. They have more pliable skin. Doesn't always mean they're dehydrated or not. So the next thing we're going to talk about is I'm going to go over his heart rate. His heart rate should be the same exact as his pulse. The normal is 32 to 44 beats per minute. Again, depending on his activity or whatnot, it could be higher or lower. For this, you use a stethoscope so I can listen to it. So you can listen to it, and you can take it for 10 or 15 seconds. Again, if your horse is not willing to stand still as much, 10 seconds is the better option. If you have a more patient horse or you just can't really hear anything, you could do it for 15 seconds. 10 seconds, you'll multiply it by 6. 15 seconds, you'll multiply it by 4. So I'm going to listen in, and she's going to time me whenever I tell you to go. Okay, go.
Stop.
So for this, I got 6. 6 times 6 is 36. Same exact as his pulse, normal range. Next thing we're going to talk about is your gut sound. So for this, you definitely want to always hear something in the 4 quadrants. So there's 4 quadrants, which is the upper and lower on both sides. You want to always hear gurgling and rumbling in there. Again, they should always be digesting food because they are grazers. So to listen to that, you're going to make sure, again, that you're here, and you're going to turn your body towards their butt. You can use a stethoscope if you prefer, or to use your ear. I personally like using my ear. So for this, you're going to start in the upper quadrant. You're going to listen.
Oh.
In which he's rumbling and everything's going on there. Same with this side. So then you're just going to go around to the other side. Then we're gonna do the same exact thing. Which is a constant grumble, which is always good. Don't want there to be any sounds. If there's no sounds at all, that means they could be definitely colicking. There could be an impaction in one of the intestines. Again, is also you don't want to listen. You want to make sure that they're not hypermodal. Hypermodal is when there's a lot of runny noises. So that is always a bad sign. Again, you can also have gas colic, which is you'll hear just kind of little gas bubbles go around. So again, you want to make sure that there always are grumbling noises and that your horse is always awake and aware of everything that is going on. So the next thing we're going to talk about is his respiration rate. So for that, you will look at their flank. You can also look at their nostrils, but the flank is the easiest part. And every time he goes in and out, that's considered 1. Normal range is 8 to 16 breaths per minute. Again, you'll do it 10 to 15 seconds. You will also do it and multiply that, the 10 seconds by 6 and the 15 seconds by 4. So I'm going to listen to him. I'm going to ask my handler to time me. And I will let you know when to start. And you always want to make sure that they know you're here and aware on their body. So, whoa, buddy.
Oh boy. Blue hoe.
There you go.
Stop.
So I got 4, so 4 times 4 is 16, so again, normal range. He's breathing a little fast, but it just could be it's chilly out and he's cold or anything like that. So the next thing we're going to talk about is the temperature. So for this, you can use a digital or a mercury thermometer. For the mercury thermometer, you would hold it, clip it onto their tail, so if it slips in, you don't lose it at all, because that is not a good thing. We also use the digital. The mercury thermometer is going to be higher than the digital thermometer, so if you ever question anything, you could always use one or the other. So you always want to use Vaseline. So for this, I will do the mercury thermometer second, the digital.
Oh, do you want to stick somewhere?
You always want to do the tip with Vaseline and rub that on there. Then you're going to come over to his back end, and you make sure he knows that you're here. You're going to lift his tail to the side. You're going to turn it on. Then you want to insert it, but on an angle, so it's against their wall. If not, there's a chance you can hit some manure, and that way that'll throw off the temperature. And it'll make it a little more hot. So his temperature is 99.2, which is a little below normal. The normal range is 99.5 to 101.5. It could be a little colder because it is cold out, so their body temperature will naturally just be colder. When you're finished with this, you can just wipe it off on their tail. And again, this is a normal range for him. Not all horses are going to be in that exact range. The next thing we're going to do is the mercury thermometer. So this is the same exact thing. We'll take this out. Put some Vaseline. Or you can use petroleum jelly. You always want to shake it out to the bottom before you do put it in, just to get all the mercury to the bottom. I'll shake it out. Okay. Same thing, you're going to take this, and you're going to lift his tail to the side. You're going to clip it just on a piece of hair. You're going to put it in, again on an angle. You're going to hold it there. You're going to want to sit here for 2 minutes. So if my handler would set her timer for 2 minutes, that'd be great. So then after the 2 minutes is up, you're going to slowly slide it out. You definitely always want to make sure you do have the lubrication on it, whether it is petroleum jelly or Vaseline. It just slides in easier and it's more comfortable for them. And after you're done, you can just wipe it off on their tail. Then you're going to rotate it until you can find the temperature, which I have. Which it looks to be 99.8. So again, it's going to be a little higher then the digital thermometer, which is always fine,